You want to be on TV?
Yeah.
You're going to be on TV, sir. Channel 3.
All right. Hey, I've been waiting for my break.
You're at least YouTube famous.
Yes. I'll take what I can get. All right, let's start with the back. And this is probably the hardest part of the legs because these muscles kind of look all the same, right? How are we supposed to know what they are? But there's an easy way. First of all, we got to orient ourselves and think, where are we on the leg? This big sheet of tissue, that's the iliotibial band. So we know that's on the lateral aspect of the leg. So then all we have to do is go one over, and the first muscle is the bicep. That's kind of a familiar name. Bicep femoris, because we have bicep brachii, we have bicep femoris. Okay? So let's say the tape is not there, though it's here. Then you follow it down, you go, oh, there's this huge tendon. The tendon goes all the way down, and I can feel the tendon on my own leg, and all of you guys can. Huge tendon. So there must be something tendinosus, semitendinosus. Yeah? So some people just, they find the IT band, first one's bicep femoris. Second one, semitendinosus, or IBS, irritable bowel syndrome, that's it. IBS, iliotibial, bicep, semitendinosus. On the cadaver, we're going to see the big tendon. So that kind of helps your brain. You go, okay, that's a huge tendon. Their action is this. And what is that action? Flexion. Yeah? This is flexion too, right? Reducing the angle here, flexion here. Right? This big muscle, think of stomach. Because in someone who has well-developed calf muscle, it looks like a stomach. Two bellies, gastrocnemius. And then think of our ancestors, okay? Long ago, if the hyena came up and bit us in the calf, we could still keep running because we had a soleus underneath, which has the same jaw. It's called a synergist. So together, the action is plantar flexion. So we're looking for our enemies. So it's an important move, big muscle, big action, okay? Now, they both join this huge, it's the biggest tendon in the body. You guys are gonna be amazed when you see it on Tuesday, because that thing is like, well, it's thicker than my thumb. And it's attached to, what is this bone? Calcaneus. So that tells you the name of this is calcaneal tendon. The old name was Achilles, yeah, Achilles, which is kind of a fun name, calcaneal. All right, so we got the leg pretty well covered, but we need to address the gluteus. Now, you'll see this on the cadaver as well. The muscle fibers don't go straight up and down. And that's why when we do squats, you know, that's not really a good exercise for the booty, because these are what are called lateral rotators. So if you're really going to work your booty, you do this. But the problem is that's how people damage their backs. You know, they have a lot of weight on their back, and so. But it's a lateral rotator, and so is the gluteus medius. This is the one where you get a patient that's really sick, and rather than put an IV in, you can give them a shot of penicillin right here. But you'll see on Tuesday, if we miss, we're going to hit the sciatic nerve, and that person will be screaming at us. It's a huge nerve, big as my finger, it goes down the leg. Okay, so gluteus medius, gluteus maximus. Think of lateral rotation, okay? Big movement, big muscle. So that must have been important to our ancestors, you know, to be able to do this. Escape. Coming straight up the back off the iliac crest, or the erector spinae. So if your patient's young and they're complaining of a back pain, it's usually the muscles. Erector spinae going all the way up. We'll see it on the cadaver. Can't see it too well here. If they're older, usually it's spinal stenosis, you know, the vertebra is crushed. But someone young, you just get them on ice pack here. Just takes care of it. Up at the top, trapezius. So it's trapezoid shaped. Its action is, it's going to attach to the scapula. And we know the scapula. And so it's going to sort of elevate and rotate the scapula. There's the action like that. All right. So that's the trapezius. Latissimus dorsi is the huge muscles at the side. Right? And sometimes they're called swimmer's muscle because For swimming, it's the recovery stroke. So here's the action, right there. So it's an antagonist against what muscle? Right. Antagonist means it fights against what muscle? Pectoralis. Okay. Pectoralis wants us to do this. Latissimus dorsi says, no, we're doing this. That way we have pretty good posture. If someone overdevelops the pectoralis, and sometimes you see guys, they're like this. So, latissimus dorsi, the swimmer's muscle. So it's going to sort of rotate the scapula and bring them out like this. Latissimus dorsi. Lat means wide, and dorsi means back, wide back. Okay, the arm can be considered difficult, but it's really simple. We have this huge muscle called the tricep brachii, 3 heads, and it fights against the bicep. So what's this action?
Flexation.
What's this action?
Abduction.
Extension. It is kind of a little bit of abduction too. It is a little bit. Okay, so this is big extender. And it goes right in between the two teres muscles. Teres major, which is big. Teres minor, which is right above it, right at the split. Okay, teres major, teres minor. We don't have to learn the action of this, but we just need to know the name. Here's the spine of the scapula. So the prefix for under is infra. Infraspinatus, supraspinatus. This is a common muscle that's injured, supraspinatus, because it gets pinched by the scapula. Right. And over this, on the top of this, is the deltoid, which deltoid is going to, people think this is deltoid, but really a deltoid is going to abduct. Brings it out like that. Deltoid's on top. Oh, forearm muscles. All right. Sometimes people think this is really difficult, but it's so simple. If you remember, digit means finger. Okay, digits. So if you have many digits, digitorum. And there's only one tendon, let's say on the chest, the tape's right here. You follow it down, and it splits into 3 tendons. So many digits, digitorum. What's this action?
Extension.
Extension. Extensor digitorum is the name. See all the muscles on the top? Extension is part of their name. So on a test, anything that's here, you got to look for the word extend. Okay, extensor digitorum. If you follow it, let's say the tape is here, you follow it down, it goes to the pinky. Extensor digiti minimi, because that means the little finger, digiti minimi. And then the word for wrist is carpi, extensor carpi. It's along the ulna, ulnaris. Okay, so digitorum, many fingers, digiti minimi, little finger, carpi, wrist. Combined action, extension. Very easy, yeah?
Mm-hmm.
Wait for today.